and assess for any allergic reactions like a skin rash, urticaria. And I'm sorry if I butcher any of these names. I really cannot pronounce to save myself. Teaching needs. Instruct patient to take full dose and do not miss any doses. Report diarrhea, abdominal cramping, fever, or bloody stools. Advise patient to report superinfection. Again, the furry growth of the tongues. Oh my god. Vaginal or anal itching or discharge. Okay, her next medication is enoxaparin. So it's 70 milligrams IM twice a day. This is an anticoagulant, helps prevent the formation of blood clots. This one is because she has arterial disease. Side effects: bleeding, anemia, nausea, vomiting, constipation, edema. Nursing considerations: monitor for signs of bleeding, assess for additional or increased thrombosis, monitor patient for hypersensitivity, chills, fever, urticaria. Observe injection site for hematomas, ecchymosis, or inflammation. Teaching needs: advise patient to report unusual bleeding or bruising, dizziness, itching, rash, fever, swelling, or difficulty breathing. Advise the patient not to take aspirin. Her next medication is gabapentin. That's 400 milligrams PO twice a day. This one is to decrease her pain. So this is to control the pain of the necrotic pinky toe in her left foot. Side effects: confusion, depression, dizziness, drowsiness, suicidal thoughts, the worst thing that can happen. Nursing considerations: assess pain, monitor frequency and intensity of pain. Do not take the medication. Well, teaching needs: do not take the medication within 2 hours of an antacid, and gabapentin may cause dizziness and drowsiness, so avoid activities that require alertness. And report any suicidal thoughts. The last one is metoprolol. This one is 25 milligrams PO twice a day, is an antihypertensive. This one is to decrease the initial diastolic blood pressure because she came in with high blood pressure. Side effects: fatigue, weakness, erectile dysfunction, bradycardia, heart failure, pulmonary edema. Nursing considerations: monitor blood pressure before and after administering medication, monitor INOs, and her weight as well, monitor her weight and symptoms of heart failure, so dyspnea, crackles, rales, weight gain, peripheral edema, jugular vein distension. Teaching needs: instruct the patient to take the medication at the same time each day and do not stop abruptly. Check pulse and blood pressure before taking the medication. May cause drowsiness, so again, avoid activities that require alertness. Change position slowly due to orthostatic hypotension, and it may increase the sensitivity to cold. Okay, so onto my care plan. Also, she didn't have any allergies, and she was a full coat as well. So my care plan, my med-surg diagnosis is ineffective peripheral tissue perfusion related to smoking, as evidenced by decrease of peripheral pulses, delay in peripheral wound healing, and rotting of the left pinky toe. So my interventions were assist with position changes as soon as she was able to move. This one reduces the risk of orthostatic hypotension. It also helps with her skin, so she doesn't have any breaks on her skin from sitting in one position too long. Also promotes circulation as well. Promote range of motion to further reduce circulatory compromise. Monitor peripheral pulses to prevent loss of a limb and to monitor for any changes, any worsening of her pulses. Keep the patient warm to maintain vasodilation and blood supply. And my outcome was that the patient was going to change positions in bed at least once by 1700. And that goal was met. I was able to help her switch positions. Number 2, show no further worsening symptoms throughout the shift. And she didn't. I rechecked her peripheral pulses. They were still there in the same spot that we last heard them at. My second nursing diagnosis is the knowledge deficit related to hearing loss on both ears and the procedure in the angiogram, as evidenced by having to speak to patient close to her ear and patient needing repetition of what is being told to her. Interventions explain to patient that she must lay supine for 4 hours after angiogram to prevent bleeding complications. Number 2, explain to patient what a pure wick is. So this way that the patient knows that what it's there for, and so she doesn't attempt to remove it. Number 3, speak close to the patient's ear to make sure that she can hear me and she understands what's being said. Number 4, assess the patient's level of understanding to verify that the patient understood what was said to her. So my outcome was comply and remain in bed for at least 4 hours after angiogram. And she did, so she did comply with that. Number 2 is the patient will repeat the reason for staying supine and the reason for the pure wick, which she did right after I explained it to her. I asked her if she heard me and if she could repeat what I just said, and she was able to repeat it. Basically, that's it. I believe I covered everything. So, yeah. Bye.